Welcome back, everyone, to another episode of Mind Matters, navigating head injuries and concussions. Today, we're going to wrap up a great conversation we've been having with Dr. Mbeo about expanding and emerging technologies and treatments towards brain injury. Dr. Mbeo, it is great to see you again.
One of the emerging therapies in traumatic brain injury and in addressing the consequences of a TBI is what's called a stellate ganglion block. We talked about the sphenopalatine ganglion. So it also starts with an S. It's also a head and neck ganglion. The sphenopalatine ganglion in the nasal passages is how we access it. Now, the stellate ganglion, named so because it has a star-like appearance. When we look at it histologically under the microscope and then in cadaver labs as we try to understand anatomy, it has a star-like appearance, the stellate ganglion. And that's located in the neck area. So the stellate ganglion. Now, an interesting collection of nerve cells. So a ganglion, when we talk about that as an anatomical term, a collection of cell bodies. So the stellate ganglion is a collection of cell bodies that lives on both sides of the neck. It's one of a few ganglia that live around the rest of our body. Now, the stellate ganglion is unique because it is what we call a sympathetic ganglion. It's one of the relay centers in the head and the neck and in our body. It's one of the relay centers for the fight or flight responses. So the adrenal glands are really known for that fight or flight response, the adrenal glands that sit right above the kidneys. But we have a similar collection of nerves or cell bodies in the neck area called the stellate ganglion. Does a similar thing. The difference between the adrenals and the stellate, not just location, but the difference becomes the part of the body that ganglion serves. So the stellate ganglion takes care of the fight or flight response or the sympathetic drive that is felt in our upper body. And we'll talk about the upper part of our thorax, our arm, and our head and neck. So the stellate ganglion has that role. So a really important role. For a long time, what we knew from the medical side of things was that by altering the stellate ganglion, altering responses in the stellate ganglion, we could help in many conditions, such as decades ago, it was used. So blocking or putting the ganglion to sleep using certain techniques, using local anesthetic techniques, for example, local anesthetic nerve blocks could help in refractory cardiac arrhythmias. So in the intensive care unit, patients that had really refractory rapid heartbeats that were not responding to what we conventionally use, delivering a local anesthetic block to the stellate ganglion, surprisingly and miraculously actually had an effect on calming that overdrive, calming that down. And so it was used for decades. And as time went by, it got lost in history, in the pages of history, but then came back as a technique that we started to use in other places. So we again started to explore, can we use stellate ganglion blocks to help in pain conditions in the arm and pain conditions in the head. And then even more recent, we started to realize that blocking the stellate ganglions, again, stellate ganglion blocks, also have shown benefit in conditions such as PTSD. So that heightened anxiety and that overdrive, those paroxysms, those storms of sympathetic overdrive that'll happen in many situations, including traumatic brain injury. So blocking the stellate ganglion does have an effect as far as calming that down. So calming the overdrive that patients that have had an injury, a brain injury, even auto accidents without a brain injury, calming down the stellate ganglion has a tremendous benefit in calming down the PTSD that patients experience in a complex way. But stellate ganglion block has become one of those emerging therapies that we use in that situation. Some practitioners also use stellate ganglion blocks in some post-COVID sensory changes, such as post-COVID loss of taste and loss of smell. And so there's some early suggestions that blocking overdrive from the sympathetic ganglion in the neck also has a benefit in that. But as we're talking about injuries and traumatic brain injury and auto accidents and certain accidents that will trigger or will be associated with PTSD, stellate ganglion blocks have a tremendous benefit. Now, in our military veterans and veterans that have had traumatic exposures and do come back with PTSD PTSD and heightened anxiety, stellate ganglion blocks are actually quite a commonly deployed intervention. So again, in some VA facilities, yes, some VA facilities also, they have clinics that are dedicated to offering stellate ganglion blocks for PTSD and the heightened anxiety that many times will be associated with the kind of exposures that our veterans might experience. So it's quite a benefit as far as one of the emerging treatments for accident-prone individuals, or accident-exposed individuals, and certainly TBI does have a high association with PTSD. So stellate ganglion block, it's one of those new ones, and we'll see a lot more over the coming years.
That is amazing. Yeah, that's another one I'm not as familiar with. You mentioned some of the ICU applications, but yeah, I especially liked what you had to say there at the end, especially referring to some of our military PTSD, or, you relate that to any PTSD. You've got, sexual assault victims or car accident victims. The implications of using something so, an intervention like that, that has some pretty exciting potential there. That's amazing. I am going to do a little research there.
Quite the appeal to it is that medication sparing benefit, where we're sparing an individual from having to titrate up and down with certain medications and add on other medications and things of that nature. So with the stellate ganglion block, we're able to, in a minimally invasive way, carefully guided way. In the past, we used to use landmarks, and so many people still use landmarks, just palpating certain anatomical structures in the neck to help us know where the stellate ganglion is. So landmark based, but nowadays we use some form of guidance. So ultrasound guidance to identify the structures around the stellate ganglion and then deliver the medicine there. We also use X-ray guidance or fluoroscopy guidance to get it there. So minimally invasive and carefully guided procedure that allows for, reduces that need for many of these medications.
Yeah, I'm all about, I think I said it up front, we are all about, kind of reducing the polypharmacy you see so much of it, especially when you're talking about, like psychiatric meds. Those things get layered on, and it's kind of hard to untangle once you get in there. So that's very exciting.
So in the neurointensive care unit, so I have used stellate ganglion blocks in a situation that some patients will run into in the neurointensive care unit, what we call vasospasm. So after a brain bleed and blood products spilling around the brain blood vessels, one of the feared consequences of that process is cramping down of blood vessels. We call that vasospasm, and sometimes that cramping down of the clamping down of blood vessels and the narrowing of blood vessels that happens because of that, unfortunately can add injury to an already injured brain. And so in the neurointensive care unit, as we offer many therapies to help with this clamping down of blood vessels, the vasospasm we're talking about, stellate ganglion block has found a role as well. And I recall quite vividly one of the patients I was fortunate enough to take care of, and as I understood some of the emerging uses of the stellate ganglion block, this particular individual was going through what we call refractory vasospasm. We threw everything that we could that was in the textbook to try and help ease up these blood vessels that were on overdrive and really clamping down and causing strokes. And at some point, when we felt we were out of options, we said, well, there's a tried and tested technique that was described decades ago, the stellate ganglion block, and it does have a benefit in brain blood vessels. Let's see if we can help out in that situation. And right before our very eyes, we have complicated probes that we can use to understand how oxygenation behaves in the brain, especially in a patient that has vasospasm. And right after delivering the stellate ganglion block, right before our very eyes, we saw the brain oxygen numbers go up. We saw metabolic numbers become positive. So the lactate numbers, so lactate, that's telling us that the brain is under stress, slowly drifting down. So things that showed us that the block was helping. Not only that, when we took a chance to ultrasound the brain and look at the blood vessels, I'd say about 24 hours after, saw an easing up of this vasospasm that had not been responding to anything, and a couple of repeat stellate ganglion blocks. And I'll tell you this, I was really happy for this particular patient, because we were eventually able to take out that breathing tube. This gentleman was able to wake up and interact with the outside world. Progressed on to physical therapy, so had inpatient therapy in the hospital, and was quite had quite a positive outcome. And this in a situation where we used everything that we had available to help, and many times the end of that is, well, we're out of options, and unfortunately the patient is out of options. So the stellate ganglion block proved itself to be quite a good intervention to help with the brain, and so many other uses.
As you mentioned, as a neuro ICU nurse, those subarachnoid hemorrhages that are in vasospasm, those are some of the toughest patients to take care of. They're so fragile, and once vasospasm starts, you're just kind of along for the ride trying to manage it. And that, man, I wish somebody would have brought that intervention along back in the day. But it's exciting to see. It's funny how old
Yes.
interventions things seem to have a way of coming back in style or finding new uses, we'll say.
Finding new uses. Absolutely.
That's great. That's awesome, man. That got me going, because that just brought me right back, man, to all those days. So thank you for that. Okay, everyone, that's going to do it for another episode of Mind Matters, Navigating Head Injuries and Concussions. I hope you've enjoyed our time with Dr. Mbeo as much as I have. Dr. Mbeo, thanks again for sharing all of the knowledge and insight and your passion that you have for concussions and brain injury patients. And so to our audience, as always, please remember to like and subscribe to our channel so you can stay up to date on all our latest and greatest content, and please hit that bell for notifications. And if you're in pain, call Shane at 980-999-9999.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.